end of the presentation. To ask a question at that time, you can use the raised hand function found in the control panel at the top of your screen. I will announce your name and your outlet, and we'll get you unmuted to make sure you can ask your question. With that, we'll start with Commissioner Showalter.
Thanks, Ellen. Good morning, everyone. I'm Jim Showalter, Commissioner of Minnesota Management and Budget, and I'm joining you from my home office. Today, you'll also hear from Dr. Laura Kalambakidis, State Economist, and Britta Rayton, State Budget Director. We want to welcome you to MMB's first virtual forecast presentation. A little unusual. Delivering November 2020 budget and economic forecast, which gives you up-to-date information on our state's budget, as well as new U.S. economic data from our consultants, IHS Markit. Last February, Dr. Kalambakidis mentioned that one of the risks of the 2020 February forecast was the, quote, prolonged and widespread virus outbreak, end quote. Before COVID-19, Minnesota's economy was in good shape, and we had a projected surplus of more than $1.5 billion for this biennium with low unemployment. By May, MMB took unprecedented action and released an interim budget projection to give policymakers updated budget information as they planned for the end of the legislative session. Due to volatile economic conditions, we projected a $2.4 billion deficit for the current biennium, which was nearly $4 billion change from the February forecast. Today, I have some good news. Minnesota's forecast has significantly improved even as COVID-19 impacts remain. Due to improved economic conditions, the projected deficit anticipated last May has been eliminated, and we now project a $641 million surplus for the current fiscal period. I want to be clear that this does not use any of the budget reserve. For the next two-year budget, we still project a shortfall of $1.3 billion, which, while a challenge, is still an improvement from the $5 billion projected as a shortfall in May. Behind this rosier picture, we still have revenue issues compared to where we started last February, and today's forecast only adds back about half the revenue taken in May. The other material difference in today's forecast is a reduction in spending, and Budget Director Rayton will touch on this in her presentation. We know that the pandemic has affected all Minnesotans, bringing with it a run of discouraging events and news, especially for lower wage workers, where the economic impact has been concentrated. We still have challenges ahead, but this budget and revenue forecast brings a bit of good news to the state. I'm going to walk through a couple of slides here, giving you the top line numbers as to the state finances, and then we're going to walk through the economy and revenue numbers, as well as expenditure changes that really lead to these conclusions. This first slide shows you the information for the current biennium, which ends in June 2021. As mentioned earlier, you'll see that our estimated bottom line significantly improves with a swing of nearly $3 billion since May. This is a result of $1.9 billion in additional projected revenue and $1.1 billion less in projected spending. This change is unusually large for a forecast this close to the end of the biennium. It's also important. With only 7 months left in the fiscal year, the state has fewer and fewer options to balance the budget. Unlike the federal government, there's not borrowing to deficit finance. So based on these estimates, this biennium's budget can be balanced even without using any rainy day funds. The next slide shows that this improvement isn't temporary. We see similar improvement in the next budget period. The first column again shows the estimate for the current period with a projected $641 million surplus. The second column shows planning estimates for fiscal years 22 and 23. These estimates provide the foundation for Governor Walz and the legislature from which to build their budget proposals. In our estimates, we anticipate spending to exceed revenues by $1.3 billion. This means that while the budget is improved, we still see a $1.3 billion shortfall in the forecast for the next biennium. Finally, there's a $491 million on this chart. Anticipating your questions, this is not a forecast change. That change in reserves is a transfer from the budget reserve to the general fund. That's a result of the 2019 end of session budget negotiations. So that's the top line picture. But now let's get into the rest of the story. I'm going to turn it over to Dr. Kalimbakidis, who will describe changes in our economic outlook.
Thank you, Commissioner Showalter. I'm Laura Kalimbakidis, Minnesota State economist. So I'm going to start with a high-level overview of the revenue forecast change, which I don't usually do, and then jump into the economic outlook. So the extraordinary volatility and uncertainty in the economy since the beginning of the global COVID-19 pandemic has led to changes in our economic and revenue forecasts. In this chart, the height of the bars shows each of the three revenue forecasts for the current biennium, fiscal years 20 and 21, that we've made this year. In May, we released, as you know, our interim budget projection as the pandemic was taking hold, as economic activity was being restricted to slow the disease spread, and the economy was contracting after a record-long 10-year expansion. At that point, U.S. real GDP was expected to decline 5.4% this year. Record numbers of Minnesotans were filing unemployment claims, and the state unemployment rate was spiking at 2 percentage points above the peak in the previous recession. As shown in the second bar in this chart, in that May projection, we reduced the revenue forecast for the current biennium by $3.7 billion. Economic conditions have improved since May as some restrictions on activity have been lifted and federal payments have supported businesses, consumers, and governments. Consequently, we're now adding back $1.9 billion to the forecast, or about half of what we took out in May. This is illustrated with the third bar in the chart. I'll now turn to describing the economic outlook that underlies our revenue forecast. In this chart, the height of the bars shows annual U.S. real GDP growth. The dark bars show the history and the November forecast by IHS, Minnesota's consulting firm. The gray bars show IHS's April forecast. That's the one that informed our May interim budget projection. In the history, you can see the economic contraction or the decline in GDP that occurred during the last recession, when GDP fell 0.1% in 2008 and 2.5% in 2009. And then that was followed by 10 years of growth. Now, if you focus on the right-hand side of the chart, you can see the forecast change. IHS now expects real GDP to decline 3.6% this year compared to the 5.4% decline they expected in May. This improvement is due to higher consumer spending and business investment so far this year than had been forecast in the spring. Annual growth is expected to return in 2021 at a rate of 3.1% and continue through the remainder of our forecast period. Both of the forecasts show a decline followed by a large acceleration. The magnitude of the acceleration in 21 is smaller in the November forecast because the smaller decline in 20 means you don't need as high a percentage increase to get back to where you were. Real GDP is forecast to grow an average of 2.7% annually through 25. IHS expects real GDP to regain its pre-pandemic peak in early 22 and the economy to return to full employment in 24. The economic recovery is expected to be uneven, with GDP associated with production of goods having already reached its pre-pandemic level, and the service sector is not expected to fully recover until a significant portion of the population is vaccinated against COVID-19. The U.S. outlook remains volatile and uncertain and depends critically on the path of the pandemic. In this forecast, IHS assumes that the rate of infections, hospitalizations, and deaths remain elevated until a COVID-19 vaccine is widely available, which they assume will be in the middle of next year. At that time, they expect the economy to transition from recovery to expansion, particularly in the sectors that are hardest hit by social distancing and safety concerns, such as consumer spending on entertainment and travel. In this outlook, IHS also assumes no further federal fiscal stimulus beyond measures already enacted. So any additional federal support, whether it's by the end of this year or in the first quarter of next year, or a more rapid vaccination timeline, would both cause the economy to grow faster than shown in the November outlook. Now let's move to Minnesota. In this chart, the line shows the last 11 years of Minnesota total employment. During the economic expansion, Minnesota experienced steady employment growth, adding 337,000 jobs. In February, employment had reached about 3 million. Then the pandemic hit, restrictions were put in place, and Minnesota lost 388,000 jobs in March and April. As some restrictions were lifted, the state regained just over half that number of jobs through October, leaving employment 184,000 below the February level. Note that at the end of the employment curve, at the end of that line, the curve is beginning to bend or become flatter. That means that the pace of job growth in the state is slowing. We've already reaped the easiest job gains. Further gains will be harder to achieve. During the most recent months of job growth, Minnesota's unemployment rate has fallen from the May peak of 9.9% to 4.6%, well below the U.S. rate and ninth lowest among states. However, the last 2 months of employment decline have occurred because of the last 2 months of unemployment decline have occurred because of Minnesotans leaving the labor force rather than from unemployed workers finding jobs. Since February, 107,000 Minnesotans have left the labor force. In the next chart, we show the annual growth rate in total Minnesota wage and salary income. So that's the sum of all the payrolls of all the employers in the state, and the height of the bars show the growth rate in that variable. The dark bars show the history, and the striped bars show our new forecast. Again, you can see the decline in total wage income that occurred in the previous recession, 4.8%. We are now forecasting a decline of 1.4% this year, and moderate growth averaging 4.8% annually thereafter. That 1.4% decline is a significant improvement from the wage contraction or the wage decline that we expected in our May projection. So how can we have a relatively small decline in wage income this year when our unemployment rate peaked at such a high level? The reason is that unemployment in this economic downturn has disproportionately impacted low-wage workers. We know that a large share of unemployment insurance benefit claimants in Minnesota were from lower wage occupations. And there's evidence from U.S. data that the duration of unemployment is longer for low-wage workers than for higher-wage workers. This has led us to forecast a smaller decline in Minnesota total wage income than we projected in May, and that improvement has increased our income and sales tax forecasts. Another unexpected phenomenon, shown in the next chart, in this downturn has been a shift in consumer spending patterns. First, consumer spending in general this year has been higher than forecast. That's one of the reasons underlying IHS's improved U.S. forecast. Second, consumers have shifted away from spending on some kinds of services, on the things that are affected by social distance. Instead, they're purchasing taxable goods. This chart shows the level of U.S. consumer spending on durable goods. This includes furniture and electronics, for example. The dark dashed line shows the February forecast, and the light dashed line shows the April forecast, and the solid dark line shows the November forecast. You can see from that dark line that consumer spending on these goods, which are generally taxable in Minnesota, has not only outperformed expectations from April and didn't fall in the spring, but instead has increased and exceeded the February forecast. This shift has supported higher than expected sales tax revenue this year and led us to increase our sales tax forecast. Turning to the new revenue forecast, the first two columns of this table show the current forecast and the forecast change for the current biennium, and the next two columns show the same for the next biennium. The revenue forecast for fiscal year 21, the current fiscal year, reflects the 4-week pause on in-person dining, sports, and fitness establishments that Governor Walz enacted beginning November 20th and continuing through December. So we did make adjustments to the revenue forecast for that. Total general fund revenues for the current biennium, as you've heard a couple of times now, are now forecast to be $1.9 billion more than the May projection. The estimates for all major tax types have been increased. It's important to note that at the beginning of this forecast period, so far in fiscal year 21, actual revenue collections are $805 million higher than we projected in May, reflecting the improved economic forecast that I've been talking about. Individual income tax receipts are now forecast to be $500 million more than the May projection. That increase is primarily due to the projected improvement in the wage income forecast I showed earlier. Sales tax revenue is now forecast to be $808 million more than the prior projection, and that forecast is consistent with the shift in consumer spending I mentioned, and is also due to higher collections, sales tax collections so far in this fiscal year. And the corporate tax story is similar. Corporate tax is projected to generate $390 million more than the prior forecast, based on a higher forecast for corporate profits and higher collections so far this fiscal year. And the story for the next biennium is similar. Because we have a higher base of projection, because the current biennium forecast is higher, that increased, as well as we have faster forecast growth in income, consumer spending, and profits. Let me finish by reiterating some of the many risks to this forecast. I've mentioned that the economic forecast depends critically on the path of the pandemic, timing of a vaccine, and the pace of lifting restrictions on economic activity. All of those uncertainties amplify economic risks, including when and whether businesses and consumers will feel safe resuming normal activities, and whether businesses that have been affected by social distancing restrictions will make it through the next year. In addition, new federal fiscal support would improve the economic outlook relative to what we are assuming here. And finally, with 30 months remaining until the end of the next biennium, even small changes in assumed growth rates in important revenue sources can have big changes in the outlook for this biennium and the next. I'll now turn it over to State Budget Director Britta Rayton.
Good morning. My name is Britta Rayton, State Budget Director at MMB. With this next slide, we're turning to the expenditure side of the forecast. And this slide shows the change in spending projections from previous projections for the current biennium 20 and 21 and the next biennium 22 and 23. Overall projected spending in the current biennium is down by $1.058 billion relative to our prior estimates. The change is smaller in 22-23 with a $409 million reduction in spending estimates relative to our previous projections. As you can see on the chart, E12 education spending estimates are down $118 million in the current biennium when compared to our May projection. The biggest driver of this change is reduced student counts relative to our prior estimates. We were already seeing lower student counts relative to our previous projections in FY20. But there is an even greater decline from previous estimates in FY21, the current school year, as families have made different choices given the pandemic, possibly opting to delay kindergarten enrollment, opt for private school enrollment, or to homeschool their students. In total, the student count in this forecast decreased by 12,600 students relative to our prior projection for the current school year. It's important to note that this 12,600 student decline in projections is on a base of 875,000 students. So in total, it's not a very large percentage, but it does equate to significant dollar savings in the forecast. MDE projects year-over-year increases in pupil counts going forward. However, our projections still remain below previous projections in 22 and 23, and there's also savings in that biennium as well. This slide also shows decreases relative to the prior forecast in health and human services spending. The HHS expenditure forecast is down $919 million in 20 and 21 and $250 million in 22-23 relative to our previous estimates. There are three significant components of change in the health and human services forecast. The first significant component is that we are assuming that the state and federal COVID emergency declarations will continue through the first 2 quarters of calendar year 21, or until June 30, 2021. Assuming an extension of the federal public health emergency means the state will continue to receive increased federal support for the medical assistance program. The federal match is increased by 6.2 percentage points during the emergency period. And this increase lowers the state share of medical assistance by $310 million in the first 2 quarters of calendar year 21. Our previous projection, it's important to note, has already recognized this increased match for the duration of calendar year 2020. One component of receiving the additional federal medical assistance match is that the state must maintain continuous coverage requirements for individuals on medical assistance. Another significant component of the forecast change is a revision to the estimate for that requirement. We've revised that down by $175 million compared to our previous estimates for calendar year 2020. In May, when we first estimated the cost of the continuous coverage requirement, at that time there was limited data or experience to inform how enrollment in medical assistance would be affected by the federal requirement. At that time, we assumed all individuals on medical assistance at the start of the pandemic would remain on the program for the duration of the federal public health emergency. We now have 6 months of data and experience during the pandemic, and we understand that enrollment for MA basic care was 5.5% lower than previously anticipated. So there are people exiting the medical assistance program for allowable reasons, and we updated our estimates accordingly. And the third significant component of change is lower utilization of services during the COVID pandemic. And these updates were not incorporated in our May budget projection. This change is estimated to be a reduction of spending of $293 million compared to our previous estimates. And $217 million of that reduction is in medical assistance, particularly in our fee-for-service program, which is due to individuals deferring or forgoing medical services during the pandemic. This forecast does assume a slow return to pre-COVID utilization levels towards the end of the next biennium. Moving on to the next slide, we return to a view of the total revenues and expenditures in the general fund. And this slide shows the upcoming 2023 biennium, as well as provides a look at the planning estimates for 24 and 25. This slide is showing the structural balance in the next two biennia, which means we are just comparing revenues to expenditures in each biennium, without including carry forward amounts or changes in reserve levels. So you can see that we do not have structural balance in either biennia, meaning that our forecast spending in each biennium exceeds the forecast revenues. The structural gap in 22-23 totals $1.6 billion. This number is higher than the shortfall we cited earlier, and that's because the $1.6 billion number does not account for the use of the $491 million in the budget reserve that is assumed in law in 22 and 23. There is also an ongoing structural shortfall in 24 and 25 of $552 million. The size of that structural gap, though, does narrow from 22-23 into 24 and 25. This is because the revenue estimates are growing faster than the expenditure estimates, and you can see that displayed in the biennial growth section of the chart on the right-hand side. And finally, we do include an estimation of inflation on this slide for the next two biennia. This is to give a sense of the cost pressures that exist into the next two biennium and into the planning years. Inflation is generally not included in the expenditure estimates in the forecast, except in a limited number of programs where there's an inflation component in the formula or where the formula is based on actual costs. So some examples would include property tax refunds, our special education program, and a portion of our healthcare as well as debt service. The $1.3 billion in 22-23 and the $2.9 billion in 24-25 shown on the slide is an estimate of inflation applied only to those expenditures where inflation is not already included in a forecast program. And with that, I will pass it back to Commissioner Showalter.
Thank you, Britta. Before we leave this slide, I just want to emphasize again the impact of future estimates. So while we've been talking about a budget challenge in the upcoming biennium and the future biennium, those figures do not include roughly $4.2 billion in the impact of inflation. You've heard me talk about it before, and I think it's just an important point because even with this improved outlook, we still have difficult decisions ahead to ensure long-term fiscal stability. So let's go to the conclusion. We're weathering a difficult and volatile time. Just today, news was released that an additional 22 Minnesotans died from COVID-19, bringing the total to 3,615. There were 3,570 positive cases, bringing that total to 322,000. Yet amidst that incredibly difficult news is some good news, which is Minnesota's managed our state budget well. We've made smart decisions preparing for an economic downturn and ensuring that our tax policy is able to withstand the unexpected. Our rainy day fund is still at the highest level in our state's history. And if our forecast holds, we'll still be able to use it as a buffer for projected shortfall in the next biennium or to provide more services to Minnesotans affected by both health and economic crises caused by COVID-19. Good management of the state has provided time to better understand the pandemic. time to sort through the economic impacts, and an opportunity to take more thoughtful action. We still have much to learn in the coming months, but smart, long-term thinking has put us in a better position despite pandemic challenges. So before we end this presentation, I just want to thank the dedicated team at MMB who have worked on this forecast, even while balancing countless other tasks required from reporting, from pandemic response, and all the other challenges of day-to-day life. We all owe you our thanks. With that, Ellen, that ends our presentation, and we are all available for questions.
Thank you, Commissioner. I want just a reminder on how we'll handle questions here. Please use the raise hand function at the top of your screen and remain muted until we call your name. With your hand raised, I should be able to get you unmuted. I will announce your name and then we'll let you ask that question. I will try to make sure people have get a question each before there's any sort of second ones, but and I will go in order as I see them. I will do my best. My first question we have is Mary LaHammer from TPT.
Hi, my question is about, Commissioner, the volatility in this forecast. Obviously, this pandemic is unprecedented. Does there have to be monthly forecasts? How should the legislature be advised? Besides the February forecast, should we have March, April, May as you go forward?
Oh, goodness, no. I think the lesson of this is that continued looking at new information is important, but that the 2 forecasts a year is a really useful construct where we have new information. It's difficult to make mid-year estimates because of all of the information and all of the thinking that goes into a forecast. This was a great opportunity to sort of pull together all that information and not and to set the course. We manage volatility with reserves, with constant surveillance of information of what's going on in the economy and in spending, and then we make actions. And then we'll bring it all back together again in the next forecast. So I don't think this is a call for constant forecasts. I think this is a indication that our estimates and our process has actually been working quite well.
Your next question from Brian Bax at NPR.
Hey, I have a couple questions for Budget Director. Expectation that once the threat of the virus is cleared, that some or many of those students will flow back to the public school system. And then the other question relates to the Medicare comments you made, or the Medicaid comments. Does the state and the federal emergency have to remain intact in order for that money to keep flowing?
I will start with the education question. And so we were seeing already in our underlying forecast, before we kind of layered on the impact of the COVID pandemic for this current year, we were seeing a decline in pupils relative to our previous forecast. To be clear, we still had an upward trajectory in pupils, but a decline relative to the previous forecast. So about 4,000 pupil unit change was already baked into our November estimate before we layered on the impact of the COVID pandemic and families making different choices. So about 8,334 additional pupils were added into that reduction, bringing us to a total reduction in the current year from previous forecasts of 12,676 pupils. That really pretty closely tracks with the savings in the education area. It's both in general education, and there's a total student component of the special ed formula as well. So it shows up in both general education and special education. We are anticipating pupils to return, but not all in the next year. There is a stepped up assumption about return out into the coming years. To your question about medical assistance, we are assuming both the state and federal emergency declaration continue until June. There are provisions that we are required to keep in effect in terms of continuous coverage, as I mentioned, that rely on the state emergency orders in order to implement. So in order to generate the increased federal match, we need to continue the statewide emergency to continue that continuous coverage requirement to generate the federal match.
But it's mandatory that executive power remain in place, or could it be done legislatively?
Oh, it could be done in other ways, yes. But our assumption is that both in this forecast, that both are continuing in order to generate that match.
Thank you. Our next question is from Dave Orrick with the Pioneer Press.
Okay, I think I'm unmuted now. Could you explain if there is any impact in federal CARES dollars and other federal stimulus to the state accounts that play into all this?
I'll start, but Britta, I'll turn it to you for more. The simple answer is federal funds aren't part of the general fund. So these are general tax revenues like the sales tax, the income tax. And while it is certainly part of the economic story about how Minnesotans were able to get help from quick reaction by state leaders as well as federal leaders this spring, that money does not show up in the numbers that we've been talking about. And Britta, you want to just talk about some of the documents that will be available in a couple of days?
Certainly. We do have the CARES money will show up in our accounting of our federal fund, as well as we have a separate fund established for the Coronavirus Relief Fund. So as we release our consolidated fund statement that is beyond just the general fund, there will be documents that show that federal revenue coming into the state and that spending, but that's not in the general fund.
Okay, thank you. And one other question, and this is sort of a touchy one, but I want to ask it anyways. Is there any impact economically that you guys see in the number of deaths that we've had from the pandemic? Dead people have an economic impact, and I don't know if that's anything baked in, if the numbers are high enough or not.
That's a different question. Laura, do you have any sense of that?
No, we make a projection of total employment and total wage growth, and we take into consideration population forecasts when we do that. And so I think it's unlikely at this point that deaths from COVID have been incorporated into those population forecasts.
Thank you all. We have time for a couple more questions here before noon. Our next question, and again, I'm going in order that I saw your hand raised. So our next question is Theo Keith with Fox 9.
Hey, everybody. Am I unmuted now?
We can hear you.
Okay, great. One of you mentioned, I think it might have been Dr. Kolumbakitis, that the impact of the most recent 4-week shutdown on gyms, bars, restaurants, movie theaters, etc., had been factored into this latest forecast. By how much? What's the impact of that? And has it been measured if that will be extended?
Yeah, when we constructed the revenue forecast, we knew that there was going to be this 4-week pause, this temporary pause. And so we've incorporated that into our revenue forecast, but not in a way that I can isolate the impact and give you a dollar value. And we have not estimated the impact of an extension of this. We construct a current law forecast, and the current law incorporated this one pause.
And then just quickly, Commissioner Showalter, you might want to take this one, but there will be skeptics out there, of course, because of the pretty dramatic swings this year already. Understanding, of course, that you all have 6 months of information to go off of now, but Can you just address that skepticism that may be out there who's to believe these latest numbers, essentially?
Of course. This year has brought things that nobody anticipated. That when we started 2020, nobody would be thinking that the economic, the health, the social issues that we're all grappling with would all happen in 1 year. I would never have predicted I would be doing a forecast in my basement. So all of these things are unanticipated. What we can do is learn. We can keep on observing, we can keep on finding more information and make smart judgments from them. And that's exactly what's happening. We took information in May, incomplete as it was, but we took what information we had and made estimates and looked forward and tried to judge from that. Now that we're into early December, we're doing the same thing. We've got more information. We can make better estimates. We can make better judgments. We're telling you we don't know everything. We don't know the future, but we can use the information that we've gleaned from the last 6 months to make a lot better estimates and a lot better understanding of how people will react to the pandemic.
Thank you, Commissioner. I want to get through a couple last questions here before noon. Our next question is from Patricia Lopez with the Star Tribune. You are unmuted.
Thanks for taking my question. Commissioner, I wanted to ask, in the whole pantheon of different varieties of assistance that can be given, what types of state and federal aid would best foster economic growth, in your opinion, and how most effectively to target it?
Good question. As you know, Pat, in a forecast, we try not to answer too many budget questions. But I think one of the things that really stands out from the past was quick action. That when the state legislature took quick action, it allowed businesses to have some understanding of certainty of what was available. When federal action was taken, the business loans and the UI benefits were extended, and people were able to manage less uncertainty. I think that's kind of the key here. When we're dealing with really unprecedented situations, it's part of government's responsibility to try to help everyone, keep it into context, and help us all do our best.
And have you been able to get any idea about the optimal amount here?
No, I haven't. And I think, as this forecast suggests, it all depends on how you're impacted. Clearly, the impacts of this recession and the impacts of COVID-19 are really concentrated. And that some sectors, and particularly some employees and some families, are particularly hard hit. And I think that's an important and sobering fact of even within this good financial news.
Mm-hmm. Thank you. Our next question is from Esme Murphy with WCCO. Esme, you are muted.
That's me. I think you're still muted.
All right, let's move on to the next one. We can come back to that. One additional question from Tom Hauser. And Tom, you are also muted.
I'm still not hearing him.
Nope. I changed one setting that should be helpful here. Tom Hauser, are you with us? Oh, we'll go back to him too. We'll do just a couple more here. I'm sorry for the delay, everyone. I do know we have.
Can you hear me now?
We can hear you. Go ahead.
Okay. I'm not sure what's going on with the mutes, but I thought I was unmuted. I just wanted to follow up on Theo's question about this 4-week pause. I was unclear on whether you have factored in the possibility of that pause in bar, restaurant, and health club closings, et cetera, and maybe even an extension of that for another month or however long?
We have accounted for the pause that is currently in place, the 4-week pause that started on November 20th, and we have not extended we haven't assumed any extension of that.
If there was such a pause, and let's say it was even expanded to include other businesses, how big of an impact could that have?
It actually will depend on why it gets extended. So if the path of the pandemic changes in a way that requires more economic restrictions than what we already have in the forecast, then that will affect the forecast. So it depends on why it happens.
Okay, thank you.
Thank you for your patience, Tom, too. Let's go back to Esme Murphy, who is now unmuted. I see the icon. It should be good to go.
Can you hear me?
We can hear you.
Okay. All right. This question is meant with all due respect. I'm just thinking of the person who is sitting out there, perhaps hearing this, who has been struggling with their own budget, not knowing where it's going, where it's been, and probably wondering, how could you folks get this so wrong? And also, how, at a time when trust is so important in government, can they really trust what you're doing with projections of billions of dollars that is ultimately their money?
Fair question. And I think the important thing here is we're all dealing with really unprecedented situations. I don't think there were many people in Minnesota, whether economists or politicians or people on the street, who would have expected sales taxes to actually go up when we're in the midst of a significant recession. I think also just, looking at the impact that we saw from this recession this spring and comparing it personally to what we were seeing 10 years ago in the Great Recession, you would have expected much more significant impact on the state budget and on consumer spending and on incomes than we're seeing right now. So this is unprecedented. This is unusual. And I think the best thing we can do is continue to learn and understand that this pandemic is not your average economic recession. It is very unique and very challenging.
Thank you, Commissioner.
Why should people trust these additional forecasts that there's going to be a $1 billion shortfall in 2022, 2023?
I think I don't know, Dr. Kalambakidis, if you have additional. I think the key here, Esme, is quite simply that we are all understanding the impact of COVID-19 better every day, every month. That this is not something that the economy has experienced for a long, long time, none of our lifetimes. As a result, the best thing we can do is continue to monitor, to learn, and try to ask questions about what's happening and how we can react better.
And if you don't mind, I'd like to add a point or two here, and that is that, this slide that I showed with the forecast change in the revenues over the course of this year, those changes, the volatility in the revenue forecast is a direct result of volatility in the economic forecast and in the economy itself. If we hadn't done the May projection and we were just comparing today to February, we'd be taking money out of the forecast. And people would be saying, of course, there was a pandemic and there's been an economic downturn, therefore, money's coming out of the forecast. But it was important in the spring to provide the best information we had and construct a forecast so that policymakers could start making decisions. And we've learned a lot between May and now, and we will learn more between now and the February forecast. And so the fact that we will adjust it again in February will help people see how this work is done and to follow that path. And I would also add that we constructed the May forecast and this one, and the February forecast and the next February forecast using the same techniques and the same models and the same kinds of information as our previous forecasts. And so the process, people can trust the process and trust that we are producing the best forecasts we can given the information that we have and given the very rapidly changing landscape we find ourselves in.
Thank you very much.
Thank you. Our next question, Ricardo Lopez with the Minnesota Reformer. Thank you for following up when your hand wouldn't raise. So you are, we're ready for you now.
Great. I just wanted to get sort of a more of a description or quantification of how exactly the federal CARES Act money helped, factor into this current budget surplus. And I know it doesn't account for any future federal stimulus, but I wanted to hear maybe some type of a breakdown or explanation as to how significant that federal CARES Act money was in helping shore up the state's budget.
I can start if you would like, Jim and Laura, and then Laura, maybe you can talk about the economic impacts of the CARES Act. The CARES Act dollars that actually came to the state of Minnesota, both through the Coronavirus Relief Fund, which was a significant pot of nearly $2 billion that came to the state of Minnesota, as well as the programmatic specific dollars that came to Minnesota for a whole host of federal programs where they increased spending in those federal programs. All of that money comes in through our federal funds, and so they're not reflected in our general fund. And in fact, the CARES Act was very clear that we couldn't use those federal dollars to fill behind lost state revenues. So we could not supplant spending in our general fund or reimburse our general fund with those dollars. So what you're seeing here for the general fund does not include any CARES Act dollars coming into the general fund and propping up state revenues. I think Dr. Kolombakidis would say the CARES Act was very helpful in terms of the economic supports that it gave. And so maybe Dr. Kolombakidis, you want to speak to that?
Sure. The federal fiscal stimulus checks, the additional pandemic unemployment support, the PPP forgivable loans, all of those things contributed, sort of kept the economy afloat through the summer and fall and contributed to the unexpectedly robust consumer spending that we saw, that we've seen, the U.S. forecast has seen, and that Minnesota has seen, and the unemployment insurance benefits are taxable in Minnesota, and so that contributed to our income taxes. But generally, what it meant was that households that needed money at the time because they lost jobs had some. And they were able to continue to spend and continue to pay rent. Not enough to cover everyone's household budget, but it was a big help.
So, is it fair to characterize it then as a significant indirect impact on the state's budget picture? I mean, given as you pointed out, it helped keep the economy afloat, and I think I don't know how much in the spring. Sort of the state budget office had forecasted consumer spending to be as strong as it was, particularly on things like durable goods. But so was it a significant indirect impact on the state's fiscal picture?
Are you saying a significant indirect impact?
Yes.
Yes, I would say so. That federal fiscal support supported household disposable income during the course of the summer and fall. Helped businesses keep people employed, and in turn, that supported state tax revenues.
And would you expect that to have a significant impact if there's another round of federal stimulus?
Yes. The macro forecaster that we use, IHS, as I said in my comments, does not assume an additional federal fiscal stimulus. But if one is enacted and is available in the first quarter of next year, they forecast that will increase U.S. real GDP growth next year, 21, by on the order of 1.5 percentage points. And I don't have a direct crosswalk between GDP and Minnesota revenues. Minnesota's economy is tied to the U.S. economy. So if the U.S. economy is doing better, Minnesota's economy will do better as well.
Great. Thank you very much.
Thank you. Thanks, Ricardo. We have 2 questions left I want to make sure we get to. I have a question from Bill Werner with MNN over the phone. So bear with us as we get this unmuted. I'm hopeful we can get it to work. Bill, if you're ready, please unmute as you are able and ask your question. All right, we'll come back to Bill. Oh, there we go. Bill, I think we're ready for you. Bill Werner, we're ready for your question. Okay, we'll come back to Bill. Our second to last question is from Lori Sturdivant at the Star Tribune.
Ready? Can you hear me?
We can hear you. Go ahead.
Okay, hi. Question for Commissioner Showalter. Commissioner, I know you were an architect of the state's law that allows the reserve to grow somewhat automatically with November forecasts. Did this surplus forecast today trigger another flow of dollars into the reserve fund? And then more generally, what policy advice would you give to lawmakers now for the prudent use of the rainy day fund that exists?
Thanks, Lori. You're right. The reserve is really important, and it's been an important part of the state's infrastructure for a while because it helps give people time to understand the situation. It gives us a chance to have reactions and opportunities to take action when other states can't, because they're already trying to figure out how to pay the bills. This forecast doesn't change the reserve picture. It doesn't automatically put more money in. We're already at the ceiling. But I think the key long-term thing is that we constantly look at using it judiciously in downtimes and making sure we continue to invest in it in better times, simply because you don't know when you need it. And this reserve certainly has given us a lot more flexibility as a state in the last 12 months. Because when we didn't know how COVID-19 was going to impact the state, the legislature and the governor both had time to assess what was happening rather than take abrupt action in May. And that's the kind of advantage that the reserve policy has given us. And that has real impact for Minnesotans.
So prudently, what should be the use of that fund, especially for the current biennium, by the legislature and the governor in the next few months?
I think, as usual, Lori, I would caution concern, especially since we have a balance in the current biennium, because we still have a lot of really unclear and uncertain issues that will be worked out, whether it's the path of the pandemic, the impact on economic activity, whether or not the federal government is going to help states as we try to continue fighting the pandemic or roll out a vaccine, business reaction, and sustainability. There are a lot of very big variables out there, and hopefully we'll have a reserve to help us manage those things as we come up to them.
Thank you, Commissioner, and thanks, Lori. I want to give one more chance to see if we can get Bill Werner to get his question through from the phone. Bill, if you are ready, please go ahead and ask.
Yeah, can you hear me all right? I think I'm unmuted.
We can hear you. Go ahead.
Okay, very good.
Yep.
Yeah, sorry about that. I want to focus in on the unemployment situation because I know Minnesota has done quite a bit better than the nation in terms of unemployment recovering from this. But one thing that sticks out in the description here, it says, the last 2 months of unemployment decline have occurred because of Minnesotans leaving the labor force rather than from unemployed workers finding jobs. What's the mechanism that's going on here? Are people giving up? Are they just deciding, I'm going to retire now? Or do you folks have any feel for what is causing that? And could that shift in the sense that people change their minds and then we see a big spike in the unemployment rate as measured, 3-4 months down the road?
Yeah, that's a great question. We don't know why people have left the labor force. We don't, we don't ask them. You can speculate that one of the points you made was maybe people have retired. Maybe it's a temporary thing where people are needed at home for now through the pandemic. So we don't actually know why. We make that point so that people don't get a sense of complacency about the low unemployment rate, that there's another part of that story. There are other parts of that story than just that we have a 4.6% unemployment rate. It could be temporary, and that is an interesting point, that going forward, and we learned this through the previous economic expansion, that going forward, looking at the headline unemployment rate, you do want to drill down and figure out, why did the unemployment rate change? Did it change because people entered the workforce and didn't immediately find jobs? Did it go up because of that? Did it go down because people who were working decided they're no longer going to be in the labor force? So that could happen, and I would encourage everyone to continue to ask those questions as unemployment data, probably bounces around in the next months.
Thanks very much.
Thank you all for letting us go a little bit over here. I do at this point want to hand it off to Teddy Chan with Governor Walz and Lieutenant Governor Flanagan's office. Teddy, you are unmuted, so go ahead.
Thanks, Ellen, and thank you everybody for joining today. With that, Governor Walz, I'm going to invite you to come on here. The governor just arrived and is available. He's going to give brief remarks, and then we'll stick around for some question and answer here.
Well, thank you, Teddy. Good afternoon to everyone, and thank you for joining us via Teams. I know this is quite different, like much of 2020, but we wanted to make sure that everybody was on and we could have this important discussion with all of you. I'd like to start by thanking the economic team, these incredible servant leaders, public servants, Commissioner Showalter, who came back in and literally took the baton from former Commissioner Franz at a time of, as you're hearing and all are living, great economic uncertainty. I am grateful for him and his team, and I would have to believe that Commissioner Franz is probably listening to us, and so I would like to thank him for that work. As always, to our state economist, Dr. Klombakidis, always gives us great in-depth on the macroeconomics. I think the scholarship that goes into this is incredible. I spend a lot of time with her to understand this. I do think it should be noted, though, bringing the scholarship on a macroeconomic level, but understanding the microeconomics of how this impacts individual families, food on their table and their rent, is a real trait that Doctor brings to this. I'm grateful for that, Dr. Klombakidis. And Budget Director Rayton, your team has been working nonstop, as you always do. You take the inputs and start to get that data so that we can, again, look at it from a numbers perspective, but how it impacts families. So incredibly grateful. And this is a team that we came into this with AAA bond ratings, with one of the strongest fiscal positions of any state in the nation, the vision of former Governor Dayton and the legislature to build a rainy day fund, to make sure that our fiscal health of the state was solid, went a long ways to making sure that when we needed to provide help, we were able to do so. When we needed to provide testing around a novel coronavirus, we were able to stand that up from scratch in partnering with our public institutions, our private sector partners. And I will have to say, someone told me this morning that they had forgotten that you can get good news in 2020. I'm cautiously optimistic about this. I think we should take that for what it is. I'd also like to make note that the reason that this is good, because of the resiliency of Minnesotans. This is the resiliency of Minnesotans in an unprecedented public health crisis to figure out how to work in a different way, to figure out how to get their kids childcare, to care about their neighbors enough to invest and spend back in their local community, to make sure that those businesses, no matter how tenuous the situation were, knew that they were getting support from their neighbors. And to those businesses who were asked to do things, again, that at least in 100 years, no one has been asked. We've asked Americans to sacrifice, we've asked them to ration, we've asked different things, but on a scale a national and global scale, and the businesses that were most impacted by this, small family-owned businesses, hospitality businesses, did it. Because what they understood was the health of Minnesotans is directly tied to the health of the economy. So I want to just give a thank you for that. This was never a choice, and never should be a choice, between the health, public health, and the health of Minnesotans and a healthy economy. This false dichotomy that was put out that you had to pick one over the other is simply not correct. That there is a way that we can do this, both from a moral perspective of protecting Minnesotans, but also the long-term health of what our economy looks like and what that provides back to us. So I want to note, reasons to be optimistic, reasons to look. Again, some of you heard me say this, especially when it comes to the rainy day fund. Contrary to social media, I have a pretty proven track record of being fairly fiscally conservative. And if you recall, it was last January and February with the calls that we should spend down the reserves. It was too big, and we should give back that money in checks, rather than understanding that that provides the resiliency in the economy that builds the capacity for everyone to thrive in this economy. But that brings me to the next point. COVID has not hit everyone in this economy equally. Some businesses have been able to go on with changes and with changes to routine, but been able to function fairly normally as it was before. Those who were in a position and a privilege to be able to work from home and have the security of that were able to continue on in a very similar manner. But let's be very clear about this when you look at these numbers. The impact has been disproportionately on wage earners, especially those on the lower end of the socioeconomic scale, communities of color, Native communities, all of those, once again, the most fragile communities, the ones that tend to be precursors of what's going on, they have been hurt, and those small businesses that are the vitality in both large and small communities all across Minnesota. So what I would take away from this is, again, a thank you for the resiliency, the willingness to work to protect health, as well as understanding that protects the long-term value of the economy, but also a willingness to make sure that understanding not all Minnesotans were impacted equally, and it gives us an opportunity. If the federal government's not going to move further, and we're certainly grateful for the work that was done, we're certainly grateful for the CARE Act dollars and some of the emergency powers that allowed us to put things in place to protect folks. Right now, we need them to do it again. Without them doing it, we put out the proposal that we need to move a package. I think what this forecast gives us, it gives us more certainty, which is a hard thing to come by in COVID, but it gives us a certainty, and it also gives us a bridge path to that day on the very near horizon when we start vaccinating folks and we start moving towards that final phase of this COVID pandemic. We can do that now. We should be focusing this on those small businesses most impacted. Again, through no fault of their own, their financial health was impacted to protect the greater good. They made decisions that kept our healthcare workers safe by making decisions about their own hospitality industry. Those are things that we need to, first of all, lift up, but secondly, make sure that we're all in this together. So I'm going to encourage the legislature, and I know they're doing a great job with this, to keep the small business package moving forward. The mechanism that we use and how it ends up, we can come together and reach a compromise on that, but I would just encourage them, and I think Commissioner Showalter's answer on speed and quickness of response in this crisis is really critical. I think that holds true for right now, that we bridge these folks to the new year, we bridge them to the potential for a federal relief package to small businesses, and we bridge this till we start getting folks vaccinated and the threat to our hospitals starts to become reduced. We have that capacity now, and that means taking care of those workers. We need to extend federal unemployment. It's the surest way to get money to folks who are laid off. That's going to expire. Their current unemployment insurance expires shortly after Christmas. We've suggested a 13-week extension of that. That should be the bridge and the time necessary for us to get there. It's a system that's in place. Again, I'm going to give my thanks very unheralded to the folks who manage the unemployment insurance system. Minnesota was, again, singled out as being, if not the most, one of the top two most efficient systems for getting speed and accuracy of our unemployment insurance in an unprecedented volume. So I would say we need to do that. And also we've proposed a $500 one-time emergency payment to the most struggling of our families. This would be children. And I just want to be clear. The folks that were most impacted by this are children and the families that are trying to support those children. So as we think about the future, I would urge the legislature to keep those fundamental principles in hand about what created our ability to be able to attack this pandemic, be able to create a testing system, be able to get the PPE, be able to do the things we've been able to do. What created the resiliency in this economy? And there's some principles there. One is keeping that rainy day fund and thinking about long-term budgeting and how those services that the state provides are needed at a crisis time. I'm concerned, and we've asked I've asked my commissioners, I've asked our agencies that we needed to tighten belts all the way around. But I'm also concerned that some of the savings we're seeing is people potentially not getting the help they need at a time where they need it. And I think that sets us up as we look forward to the next budgeting. We're right in the heart of the worst part of this pandemic yet, but we have the capacity to take the lessons learned from this and lean forward. And one of the lessons is we're going to, and we have got to get our children back in school. We've got to get our littlest learners back there as quickly as possible. The place where we're at in the pandemic gives me a lot of hope that we are on the verge of being able to do that. And we need to think about the investments, Minnesota, that made our economy one of the strongest in the country, made it so attractive, was our education system. It's solid, it's good. Quality of life, our state parks, all of those things that we went to. So when we go to the next legislative session, the one thing I hope we're able to do is the smart choices we make build an economy for the future that allows us to not only enjoy the good times, but weather the bad times like we're in right now. So I'm hopeful. I'm hopeful that we're seeing across the state that spirit that we're in this together. I hope Minnesotans are, again, recognizing that overall, our picture may have improved some. Just like the numbers we give on COVID, they can't just be numbers. There are families and businesses on the brink today. There are more people, 1 in 8 families, wondering where they're going to get their next meal. Children concerned about 1 in 5 children potentially going hungry each night. There's challenges in this, but the good news of the day is we have the resources and the capacity and the fiscal stability and strength to be able to make a real difference in that. And I would encourage the legislature to do that, not just now, but looking into the next budget cycle. And with that, Teddy, I'd be glad to take any questions.
Thank you, Governor. So, folks, let's do what we just did with Commissioner Showalter here. I'd invite folks to raise their hands, and I'll just kind of call through in order here as I see hands pop up. It looks like we've got Tom Hauser first in line here from KSTP. Tom, let's see if we can hear you.
All right, Teddy, you got me?
I got you. Thanks. Go ahead.
Hello, Governor. The MMB folks and state economists were saying they have factored in the fact that you have a 4-week pause on bars, restaurants, and health clubs right now, but they have not factored in what if that gets extended. A lot of Minnesotans are wondering, now that you're saying Christmas family gatherings might be similar to Thanksgiving, are you likely to extend past December 18th the current economic pause?
Well, no, thank you, Tom, for the question. I think when this got asked yesterday, I know this idea that it feels to people that things are sprung on them shortly. Our hope was, and we took a little detailed dive into the data yesterday, to start talking about data providing us trend data, where we're headed. And I think right now it's certainly no secret that we had, I believe, over 15% positivity today in our numbers. While overall numbers were a little lower, we're still in the middle of this. And so what I'm asking folks is to recognize that the behavior changes we make are going to have an incredible impact on what happens in those hospitals and what happens to the spread. One of the things that we've not been able to quantify, and I say we, this is CDC and everyone is, it is not so much the restrictions that are put in place, it's the compliance and the sense of how serious people think things are. My hope is that we're going to start to see some results of folks making these choices, these good choices, starting to see again that if you do really want to protect the economy, these restrictions and some of the things we're doing on capacity are actually the ways to get there. Because if you make comparisons to states that did not do this, their financial situation isn't any better, and they've got a lot more deaths. So it's always striking that proper balance. And I don't want to play coy with folks. I think it is likely that we are not out of this worst part of this yet over the next few weeks. The game changer in this is we are preparing, and there's the meeting at the White House today on vaccine distribution, what that starts to look like. I got to believe, Tom, and I'm hoping people view it this way, we're coming to the end of this thing. And whether that's in the next few months or not, that will be seen. But this is the time now, it seems to me, that if we could get just a little bit of digging in here, and I would encourage people, you can still help these businesses by ordering takeout. You can still help these businesses in ways, buying gift certificates, whatever it may be. But at this point in time, we'll still wait to see what that data looks like. But I think Minnesotans know this is a challenging time, and we're going to have more data in the next week or so of what happened over Thanksgiving.
Governor, just as a quick follow-up, that was kind of a vague answer, and I realize you're still waiting for more data, but it sure sounds like they're planning on an extension. And there's a lot of people who can't reconcile the fact that Walmarts and Costco's are jammed with people, and health clubs can't have people at 25% capacity, socially distanced, trying to get healthy. I'm sure you're hearing a lot of that yourself, but it also sure sounds like this is going to be extended. Is that the way you are leaning?
Well, I don't pick it as leaning, and yes, I hear some of that, but I also hear from emergency room physicians who are simply overwhelmed. I also hear from nurses and folks who recognize this. And again, I would tell people what we're learning, and it's not an exact science, and I've said the pain that these folks feel, one of the reasons I'm asking and pushing hard, we should be providing relief to those health clubs in this, because we're asking them to stay home. Now, again, the layman's objective is that Walmart, the fact of the matter is people spend less time closer together in a larger place with masks on, not breathing as hard. And we keep coming back to this again. The exact science around it is still pretty hard to pin down, but the general overview is the longer you're near someone in a smaller space, and if you're doing things that make you breathe harder, the chance of infections go up. I certainly, again, don't believe that there's a single health club that doesn't want their folks to stay healthy, increase their healthiness. But the fact of the matter is, whether it's here, whether it's in the other 49 states, or whether it's across the world, the data seems to support that these are areas that have higher concentration. And when you're seeing huge amount of community spread right now, the odds are pretty good that someone in that health club, even at 25%, is probably asymptomatic positive. Now, you could say, well, the same thing is true of the Walmart. It's the distancing and the mask. So I would just tell them, I don't lean in any one way. The data doesn't give me an answer and say, here, you absolutely have to do this. We take it and see the direction it's going. I just think I have to be as candid with Minnesotans as possible. Our hospitals are at the highest capacity they've been. Our death rates for the last week was as high as any week in this pandemic, and our case positivity rate is the highest it's been. If that changes, obviously we change with it.
Thank you, Governor.
Thank you, Tom. Up next, we've got Ricardo Lopez with the Minnesota Reformer, who's raising his hand here.
Hi, Governor. Thanks for taking my question. My question has to do with the stadium reserve. The projected increase of $81 million, I think, brings it now to about $230 million, which I believe is more than necessary to pay for debt service. I'm curious if there's any ability to use those dollars for any other purposes. Just potentially even something like housing homeless Minnesotans who are experiencing homelessness.
Well, there is, and I will just be candid on this one, Ricardo. I have suggested that in my budget, but I want to be also very cognizant of the legislature. This is an area that they are not real keen at, some in the legislature of using, and I want to be very candid that I understand where they're coming from on this, that this was a deal that was structured. Obviously, those revenues are up because of some of the behaviors and the tax collections around that. I always think that we should, my mantra is everything should be on the table when we look at it. I will leave it at that. The answer to your question is yes, the potential to be able to use it is there. Do I think that's going to happen? There's some real strong feelings amongst legislatures around this fund. So you have to wait and see, I guess, on that one.
Gotcha. And just a quick follow-up. With the budget surplus projected for this current biennium, do you have a ballpark number for how big you think the state COVID-19 relief package should be, just from your end?
No, not yet. We are working on that. I think you could expect to see that. And I don't want to unduly influence what I think are very healthy and very positive discussions that are going on bipartisan, bicameral wise right now. I do think, though, it gives us more certainty. I certainly think, again, recognizing that there's good news in this, but there's segments of the economy that are really hurting. This gives us an opportunity to really target that. So I don't have the number for you, Ricardo, but I'm thinking some of those early numbers you heard, being batted around probably make more sense now, that we can do a fairly robust package.
Great. Thank you so much.
Thanks, Ricardo. Next in line here, we've got Theo Keith with Fox 9. Go ahead, Theo.
Hi, Governor. You mentioned the hospital capacity and the death rate earlier. I have to ask a question about the morgue, which your administration was installing shelving at yesterday and testing the cold storage equipment. Even though we were told yesterday that funeral homes haven't reached their baseline capacity yet, let alone the surge, and deaths are still far below expectations when the state bought the morgue. So why is the morgue being prepped?
Yeah, well, first of all, from the beginning, as I said, I was not going to leave Minnesotans like we saw, whether it was in Italy, New York, or recently in El Paso, that we were going to have that capacity. Again, this facility was requested by the medical examiners, the morgues, the hospitals. We did receive a request a week or so ago from a hospital, but that wasn't the proper channel. We still had the capacity to cross level with other funeral homes to be able to get that. I think, again, seeing the surge that we have, due diligence has us to, again, be prepared. And again, I knew from the beginning, and this is one that folks keep bringing up, those that haven't really done a lot to help us fight COVID have spent a lot of time complaining about this facility. And I said, I'll own this, that this is the insurance necessary that we don't hit those numbers. I want to make sure, and it's there. We started seeing some of those numbers starting to go up. The capacity numbers I asked about, I think, are probably setting at about 60% or a little more with our medical examiners and facilities. Some of it would depend on if you had these days like 101 days. If you happen to have a big surge, would that capacity overwhelm in the short run? So it's not that there is a imminent use of using this. It's just making sure that it's functional, it's ready to go. And I would note that that this facility more than likely will be paid out of federal funding. Other states did the same thing, preparing. And I'd like to think that preparing for the dignity of our loved ones is worth it.
Thanks, Governor.
Thank you, Theo. Headed over to Esme Murphy with WCCO. Go ahead, Esme.
Okay, can you hear me?
We got you.
Yeah. Okay. My question for the governor is, a lot of people are going to hear these figures, and for those that have been drastically affected, like those in the hospitality industry or those, who have gyms, are going to want to know, when is the relief package coming? When is the special session coming? Is this going to come before Christmas? Because it really doesn't look like help is coming from the federal government, at least soon.
Yeah, no, and I'm still working them, the federal government, I mean. I still think there's every reasonable opportunity that we get this thing done in the next week or so. We have the numbers now. There's strong agreement that, that we're doing the right thing on protecting our folks, asking folks to curtail some of these activities. There's a responsibility to help try and ease some of their pain. So I'll tell you right now, Esme, I'm very optimistic. Obviously, the package won't look exactly like what I proposed. That's called compromise in a democratic system. But I get no reason, and I'm not getting any, what I feel is pushback around the desire for us to do a package and get it done as quickly as possible. And I think the sooner rather than later. I think the timing, again, that Commissioner Showalter said, and we've seen so often, if we can keep these folks afloat till we get into the better part of the new year and we're moving down a vaccination regime that is starting to spread, and we get some federal help, which I think will come with the new administration potentially, there's every reason to believe that that will make a difference. But I'm encouraging folks, let's do this. There's no reason that we can't have this thing wrapped up in the next week or so.
Okay, and quickly a follow-up. What exactly are you proposing? Can you attach some dollar figures to that?
Well, we've said, and I heard the numbers out there when the House Democrats were doing their, kind of back of the napkin response. They were looking at around $300 million in relief packages to small business. Obviously, the unemployment insurance is a little different animal. It gives us more flexibility. That's 13 weeks that would help individuals. We're asking for the $500 for the most needy families. So I think you're looking probably somewhere in that neighborhood. Again, there'll be a package probably come in at $600. There'll be one come in at $100. We'll figure it out. My biggest concern, though, is that this is targeted and timely, and it gets to those businesses who were left out of the PPP, who didn't get. I mean, we were there for the Ford Motors, the large airlines, and that's fine too. But there's a lot of these small businesses, especially in hospitality and others, that we could really get to right away. And it's my vision that we work a system out where they have this grant in their hand in the next few weeks to make a difference this month in their bills, their rent, and their payroll.
Thank you, guys. Thank you, Governor.
Thank you, Esme. Next in line here, we have Patricia Lopez with the Star Tribune editorial board. Patricia, go ahead.
Thank you. Thank you, Governor. I wanted to ask you a little bit more about the funding. So it sounds like the package could be between $300 and $600 million. Is that right? Is that the ballpark?
Yeah, just throwing those out there, Esme. What we did is we took the 14,000 restaurants and venues that were impacted and figured out what it would take to impact them, plus the $500 to the folks that are receiving that have the most needed care, and a few of the other things we were looking at. So probably, I'm guessing, somewhere in that neighborhood.
Okay. And optimally, what is the amount that you would be looking to get from the federal government in the first quarter of 2021?
Well, that's the $980 billion question today, or the $3 trillion. I understand, and I think the package that the House put out back in May was robust, was smart, made a difference. But I've been saying all along, we should just compromise. And what we really need is we needed this help for these small businesses and for individuals. We needed to make sure that we didn't lose eviction moratoriums or the capacity to be able to pay rent. And the states, I want to be candid, states do need some of this, but as you see, we're not in as dire of situation. So I think, at least according to this, I'm more than willing to take a smaller package from the federal government. And if they did that, that would go an awful long ways to being able to make a lot of these folks whole. And again, like I would say, after this is over, we've got work to do. We're going to get these kids back in school as quickly as possible. And it's going to cost some once we do that. And again, I don't know what the school year will look like. Maybe we go through the summer to catch back up. I'm willing to talk to anybody about some of these ways to start thinking about that piece of it when we come out the other end. And that's going to take budgeting certainty. So we'll see.
A quick follow-up to that on the issue of unemployment. Is the state dependent on the feds for an enhanced unemployment? Are you looking at an extension or an enhancement? And how actually is that going to get funded?
We would like them to do it, but we are willing to do it. They should do it. The federal government should be doing it. This is a failure, and I'm on record saying it. And if that irritates my Democratic friends in the legislature and my Republican friends in Washington, so be it. They should do it. If they aren't going to do it, the state of Minnesota will do it. And the way it works is we, like every other state, I think 48 or 49 other states, are using federal government funds to backfill their UI until we build back up that surplus. And what you're able to do is they just put it on your tab and you pay it back. My hope would be is if they're going to capitulate and not do the extension and help us out, the least they can do is suspend the interest on those payments, and we'll get it paid back over time.
Thank you.
Thanks, Patricia. One more question here today, Governor. We've got Mary LaHammer with TPT. Mary, go ahead.
Thank you, Governor. Earlier, you said that folks who are most impacted are kids, and you want to get school kids back in the classroom. But the budget numbers showed more than 12,000 12,000 students have been lost from the public school system, maybe some to private school, maybe homeschool, maybe delaying kindergarten, but isn't it possible a significant amount of children in Minnesota have just dropped out of school, dropped out of the numbers? And what does this do to exacerbate the achievement gap and the equity concerns we were already facing?
Yeah, I think it is possible. And that's 12,600 out of 870,000. But here's my thing is, the number I really care about is one, each individual kid. And I think you're right. We're losing something. You saw the numbers coming out of St. Paul schools. I want to thank them for getting data out early. I got one of them sitting right here in my house. I know the grades are going down, and I know this is harder than it should be. So, yes, I do think it probably exacerbated, no doubt about it. It did exacerbate the achievement gap, the inequities. That's kind of my point, Mary, that I'd like to kind of set the tone. When we come back next year, all of those things I talked about, I want, again, I certainly didn't envision my time as governor being the COVID governor, if you will. I'm the education governor is how I viewed myself. I want to make a difference in this. I said, judge me by closing that gap. Judge me what happens to our youngest ones. I'm trying to make the case that this gives us an opportunity, and we've convened a group of folks to help us. Let's come back and be creative around education. Let's come back and be creative about education funding. Let's come back and try and figure out where we failed those kids, where COVID dropped them out of the system, and how do we get them back in and make up that difference?
And Governor, if I could follow up, can you make up that difference if kids have really lost a year or even 2 years of school at this point?
Well, the research is hard. The research is hard. All of us know this, especially the youngest ones. I think that's why you're seeing across the country, and us included, there's this scramble to get those little ones back in school as quickly as possible and as safely as possible. This decision about how we're going to do vaccinations, obviously with the ethical perspective as our healthcare workers and all that, there's experts will doing this. I would weigh in on this, that we need to get teachers, especially those elementary teachers, vaccinated so that we can get all our kids back in school all across the state. If there's a way for us to think about that, I'm asking to do that. But you're right. The research is hard. That's why I think we're going to have to be more creative on what a school year looks like. What have we learned in this? I mean, and there's groups that are doing things that we weren't doing that we should incorporate.
Okay. Thank you, Governor.
Thank you, Mary. Governor, I know you've got to run on to the next thing here. Thank you. I'm going to if you have a closing remarks here, and then I'm going to hand it back to Ellen with MMB.
No, just thank you all for your time.
Thank you, Governor. All right, Team MMB, I'm handing it back to you.
Thank you, Teddy, and thank you, Governor Walz. Commissioner Showalter, if you have any closing comments, now would be the time to share those. If not, we can wrap here.
I think that should take care of it as usual. I just want to remind people that there are materials available on the MMB website. There will be more materials available on Thursday. So those of you who are familiar with the longer document with all the tables and information, that will be available. Obviously, we'll be watching how accurate we are with the monthly revenue updates that also get shown and are published on our department website. So just appreciate all your attention, and more information will continue to be coming from our team. So thank you very much.